Hello and welcome. You're my next patient? Excellent. Glad to hear it. Let me just get out my little notebook here. Alrighty. There we go. So we're first going to get you checked in, and if I can just start with your name. Perfect. To make sure my pen is pen mode. There we are. Sorry, can you say that again? Perfect. And can I get your date of birth? Perfect. And your reason for the visit today? Mm-hmm. Mm-hmm. Absolutely. Okay, so you're looking for a cranial nerve exam today then? Yeah, that's no problem at all. Perfect. Just finish writing this sentence here. Okay, we got your name, date of birth, and we've got your reason for the visit. So we're all set there. Let's see what we'll get started with. First, we'll just start with a quick breathing test. I'll use my stethoscope. Take some deep breaths. Make sure the breathing's good. Just the basics for now, okay? Perfect. Okay, let me get this back in the folder here. Okay, perfect. Okay. Okay, so I'm just going to breathe on a little bit so it's not too cold. Okay, and I'll just have you take one deep breath in for me. Perfect. And just on this other side here. And breathe in, breathe out, just normally. Perfect. And then just on the front here. Okay, and just once more on the other side here. Perfect, that looks all good there. And we've got that done. We will move on to the light test to start with. So I'm going to first start by dimming a little bit of these lights here. Dim this one just a bit. Okay, there we are. And first, I'm just going to get you to follow this light here. Okay, and just follow it. Continue following it. Try to stay focused even when it disappears a little bit. Okay, perfect. Keep your focus on the light here. And also, while you do so, just take deep breaths. Just relax and just worry about following the light here. Perfect. That's right. Perfect. Excellent. Okay. Now I'm just going to have you close just one eye, whichever eye of your choosing. I'm going to do the same and just follow it along with that eye, okay? Okay. And again, remember to just take some deep breaths and just remember to only focus on this light. Only focus on the light here. Doing a great job. Perfect. Keep following it. When it goes out of your peripheral vision, just make sure to follow it back as soon as you can. Okay. Perfect. Okay, and I'm just going to have you switch to the other eye now. We're going to do the exact same thing. Okay. Perfect. Keep following it with that one eye. Excellent. Excellent. You're doing a wonderful job. Perfect. Excellent. That looks both great with both your eyes. You can uncover your eye now. Okay, so now I'm going to have you fixate on a spot behind me. We're going to use the same light, and I'm going to try and distract you with it, but remember to keep looking at that one fixed spot. It could be on the painting behind me, it could be on my nose right here, the stethoscope, up in the corner, wherever you want. Just keep your focus on that one spot, okay? And I'm going to move the light around and check the outer sides of your eyes and see how your eye reflexes move to those points, okay? Okay. You got your spot? Perfect. Okay, here we go. Keep focused on that one spot. Perfect. Perfect. Keep your focus on that one spot there, even when the light crosses your path. Keep focused on that one spot. Don't get distracted by the moving light around it. Okay? Perfect. All right, now we're going to do it individually. So if you can just cover up one eye, and we're going to test one at each time just so I can get a more in-depth look at each eye as the action happens, okay? All right, perfect. Perfect. Keep focused on that one. That one spot. Remember to breathe. Perfect. Excellent. Okay, and I'm going to have you cover that other eye now too, okay? So we're going to do the exact same thing on that side. We're going to start up here. And here we go. Keep that eye covered. Remember to breathe. And also stay focused on that one point with that one eye. Don't get distracted by the light here. Stay nice and focused on that one spot. Okay, perfect. Fantastic, you're doing great. Okay, perfect. Stay focused. Keep breathing. All right, perfect. Okay, you know, those are looking fantastic. Your eyes have great reflexes when it comes to the light, so it seems to be doing really well. Okay, what do we have here next? Now, actually, we're not quite done with the light. We have two more. We're going to start with the same thing. You can pick the same spot or a different spot, whichever you please, and you just let me know when you see the light turn on, okay? Okay. Actually, we'll go right off the bat and we'll start with just one eye each, okay? So we'll get that over with first. Okay, ready? Perfect. 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 Good job. Yeah. Perfect. Okay. Yep. Perfect. Okay, and I'm going to give you a switch up now and do that other eye, okay? Perfect. Here we go. Yep. Excellent. Perfect. Okay. Excellent. Perfect. That's fantastic. And then we have just one more test with the light as well. This one will involve us going, closing your eyes, both of your eyes, and then you letting me know when you see with your eyes closed the light come up. When you first see that light through your eyelids, okay? When you start to see it get a little brighter, that's what we're going to be focusing on now, okay? You'll just close your eyes there. Perfect. All right, are you ready? Perfect, here we go. Excellent. Perfect. Perfect. You got it. Excellent. You got it. Mm-hmm. Perfect. Perfect. Yep. 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 Now I'm going to make it a little bit more challenging. So with keeping your eyes closed, I'm going to make the light a little bit smaller. And then just let me know when it comes and you see the light, okay? Perfect. 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 Excellent. Perfect. You got it. All right, you can open your eyes now. And that is all it for the light tests. Now we have our color tests that we're going to do here. And we are going to start with what color is it? Okay, so I'm going to hold up a color and you just tell me, as simple as it sounds, which color is it, okay? And we will be using little cardboard rectangles. Okay, so we're going to start. And just when it comes into your peripheral vision, just tell me, just say which color out loud it is, okay? All right. Perfect. 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 Now you saw little other colors, that's okay though. Perfect. Perfect. Good. 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 Excellent. Perfect. 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 Excellent. Perfect. And now I'm going to hold up multiple colors, okay? So you call out the colors that you see go up, okay? Excellent. Perfect. 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 Excellent. Perfect. 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 Excellent. And last one. Good, good. Okay. So that was pretty easy for you, so that's fantastic. I'm always glad to see that. And normally I would do each eye, but I think you were pretty quick with the responses, so I think we'll be okay for that one. Okay. And we are going to go to what color does it change to? Okay. So there'll be two colors, one on the front, one on the back. They will switch at one point or another. You just have to let me know as soon as it switches, okay? You don't have to say which color it switches to or which color it is originally by any means. Just let me know when you see the color switch itself, okay? Perfect. So we're going to start with okay, and then just let me know as soon as it changes, just like that. Perfect. Okay. Perfect. Actually, I'm going to do this another way. Let's try it this way here. Okay. And just let me know when it changes, okay? Perfect. Perfect. Good job. Excellent. Okay. Just let me know as soon as it changes, as soon as it makes its change. Perfect. This way works much better now, okay? Perfect. Yep, as quickly as soon as you see the switch, call it right out, okay? We're testing how quickly of a response we can get with the sight that responses to the brain at those cranial nerves, okay? Perfect, okay. So let me know as soon as the other one goes in. Excellent. Perfect. Now we're going to use all 5 colors. I'm going to get you to call out the one color you see, like it was doing with the switch up and you were calling it out, but this time you call the color that pops up, okay? Okay, are you ready? Yes. We're looking for speed for this one as well too, kind of like the reflex to go as quickly as it allows, okay? Okay, are you ready? And go. Perfect. 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 Great job. All right. So now we're going to do, what color is it again? But this time we're going to do it in complete darkness, okay? So what I'll do is be holding up one of the colors, and then you will see a light come up behind it, and it's a little more difficult to determine which color it is, but that's why I thought this extra challenge would be a little more, give us a little more in depth to looking at your cranial nerves, okay? Perfect, okay. So I'm going to start by just getting it a little bit more darker in here, okay? All right, and we're going to get started with these colors here. And here's the first one here. And remember from the 5 colors that you were shown earlier, okay? And which color is this? It is pink, you are right, yes. And here's the next one here. Which color is this? Perfect, yes, that's correct. We'll move on to the next one here. And which color is this one? Correct. Excellent. Yes, yellow. And the next one here. Perfect. You got that one right away. And this last one here. Which one's this? Oh, I think you were incorrect on the first one, actually. You're right, this is the pink one. Even I got that one wrong. Let's compare those two here. Oh yes, they are very similar. This is the orange, this is the pink. Orange, pink, orange, pink. Actually, we will do that for one last color and eye and light exam. We're going to fan these colors out here, and you tell me when the color in the background changes, okay? Perfect, good, yes. Excellent. Perfect. Perfect, perfect. It's hard to get them all, so I'll go try and go slower here. There we are. Changing from color to color. Remember to take deep breaths. Perfect, 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 perfect. That's correct. You got it? Excellent. Excellent. All right. Now I'm going to turn those lights just back on here. Okay, there we are. You did really well for those. That was a really cool color effect too. So we've got all the color ones done now. So we're going to move on to, it's going to sound silly, but a paintbrush. We're going to be using this to do the soft and dull test, okay? So basically I'm going to have you shut your eyes, and then I'm just going to poke you with one of the sides. It's not actually sharp, but we call it sharp or dull because it will feel a lot more soft on the one side and just a little pokey on the other side, okay? Right? Right? Perfect. 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 Yeah. Perfect. Yeah. Perfect. Yep. Perfect. Yep. Yep. Perfect. Okay, now we're just going to take the same paintbrush. What we're going to do is I'm going to tap it on um, the dull side, and you are going to count and let me know how many taps on each ear, okay? So we're going to start on this side here, and just let me know how many taps you hear. Good. Perfect. Excellent. We're going to do the other ear now. Okay. Excellent. Perfect. Excellent. Now we're going to go a little bit faster on each ear, okay? Just try and keep up with the count as best as you can, okay? Excellent. Good job. Okay. Good job. Okay. And last one for this side. All right. Perfect. Good. Good counting skills. Quick hearing as well, which is great. Just what we're looking for. Now we're just trying on this side here. Good, good. Perfect. Okay. And listen closely. Tricky one. Okay, we'll do one more on this side just to test, okay? Good, you got that one. Perfect. Okay. So then we'll be moving on to movements in the body as well as tapping, okay? And what I mean by that is I'm going to try and move your head, okay, to each side, up and down, and you just stiffen yourself and make sure I can't, or hold yourself as best as you can to prevent me from moving it each way, okay? Okay, ready? I'm going to go to this side here. Perfect, good. You prevented me there. And we're going to try on this side as well. Perfect. And then we're just going to do it up as well. Okay. And down. Perfect. Okay. That all seems to be good there. Do you find any pain when that happens at all? When you try and stop your head from moving, or for a better example, if you were on a roller coaster and to prevent your head from smacking around in the machine, do you find there's any pain when you tighten it or anything in the neck area at all? Okay, do you mind if I just give around your shoulder and your neck, just little taps? Okay, perfect. Here we go. Okay, perfect. I'm just going to do it on the other side as well. Perfect, that all looks great. And for the last one, for this one, this is going to be very similar to the arms. I'm going to do a rhythmic tap down as well, just to make sure everything is where it needs to be, and if there's any pain that you need to report or anything like that. Basically testing for any of the nerves within your arm to see if it affects in a different way, like if you're tapping your wrist and all of a sudden you feel it up in your shoulder. Could be something that we need to look at when it comes to the nerves as well, that can be connected to the cranial as well, okay? Because all the receptors come up to the brain and it's all connected within that way, okay? This one's going to be a little different. Before it was just the taps. This one we're going to be doing quicker taps down your arm on each side, up, down one way, and then back up the other, okay? All right, perfect. And we'll get started here with this side. You ready? Okay. No pain there at all, at all? Okay. Excellent. Not even a dull. No pain, okay. Good. Okay, we'll come down the side here. No pain on the wrist area or the forearm. Okay, perfect. Okay, I'll have you flip your arm. Perfect. Absolutely. Remember to take some deep breaths. Absolutely. Okay, perfect. Everything seems great on that arm, so we'll just tackle the other arm, okay? Perfect. Okay, here we go. Go up to one side here. No pain in the fingers at all. Okay, perfect. Come down the one side. I'll just have you turn your arm over here. Okay, perfect. Any numbness in your fingers or your hand at all? No? Perfect. Okay. Perfect. This doesn't hurt when I tap the inside of your elbow here. Perfect. Okay. Nothing in the bicep at all. Okay. Perfect. Everything looks great there as well. And then we will just move on to the last ones, which will be a smelling test as well as a taste test. Okay, so I've got 5 scratch and sniff smells for you today, okay? And first I'm going to use this little brush here to do the scratching. And then I will put it right to your nose for you to be able to smell, okay? And your job is to guess which smell it is for me, okay? Perfect, okay. And here we go with the first one. And give that one a smell. And what does that smell like to you? That is correct. Great job. Okay, let's do the other one here. And yes, it does take a little bit for the scratching because we want to make sure that each patient has, depending on their capability of smell, has the ability to smell the test regardless, okay? If not, then we know we have some serious issues. give this one a smell. What does that smell like? Perfect. Yes, exactly. And we'll go to the next one. So we definitely don't have to worry about you not being able to smell anything. So that's good. Okay, we'll grab this next one here. Try and stump you a bit. Okay, we'll get up with the third one now. Perfect. And give this one a smell here. What does it smell like to you? This one is a bit of a tricky one, yes. You can only choose one. Yes, that's correct. Excellent smell. Grab the next one here. No, actually, I think that was our hardest one. I tried to stump you. So these next two will probably be a pretty easy cinch for you, okay? Okay, and this one? What does that smell like to you? Yes, correct. It's a really nice smell though. Yeah, absolutely. And for the last one here, okay? And the very last one. You got it. Perfect. Excellent. So that was the last of for the smell test. And then we're going to move on to the final test, which is the taste test, okay? Okay. So I've got 5 of these vials here, each one with a different flavor, okay? Okay, they're a little tricky to get off. Bear with me. Here is the first one. And just open up your mouth and just stick out your tongue here. And I'll just put a few droplets on. And what does that taste like to you? Yes, that's what I was looking for. Perfect. Excellent. And we will grab the next one here. These lids are tricky. There we are. A little bit of it there in the vial here. Okay, and here is the second one. And if you'll just stick out your tongue. Perfect. Put a couple drops on there. And what did that taste like to you? That's correct. Yes, absolutely. Excellent. Okay, and we will do the third one here. Okay. Get some in the vial here. Yeah, if you just stick out your tongue. Perfect. Put a few drops on. Perfect. And what does that taste like to you? That's right. Excellent. Perfect. Okay, and I'll put this one up here. Grab the fourth one. Okay. Drops on here. Okay, perfect. Looks like I'll need to get some more of this one in particular. Okay, and just stick out your tongue there. And what did that taste like to you? Correct. Yes, you got it. And we are on to the last one now, okay? This one is the harder one. I did save the hardest one for last this time. Okay, and we've got the last one here. The trickiest lid of all. Perfect. Get some on this one here. And just stick out your tongue. Perfect. And what did that taste like? Excellent. Okay. Perfect. So we've got went through all the tests that I have for you today. Everything checks out fantastic. I'm not particularly worried about any specific cranial nerve at all. Everything seems to be in focus, from the touch all the way to the sight and the hearing and the tasting and the smelling. So everything seems on point. I don't think you have anything to worry about at this point. Okay? Does that make you feel better? Good, good. I'm glad to hear. Yeah, absolutely. You can always just make an appointment with the receptionist for sure on your way out. Now, is there anything else that was bugging you that you wanted to check through on this appointment at all, or was it just the cranial nerve exam? Okay, perfect. Yeah, no problem at all. If you just want to make your way down the hall there, you'll be greeted by the receptionist there, and they'll be able to take your any information for any further appointments you need, okay? Fantastic. Thank you so much for coming in, and I'm glad everything was fantastic today. Alrighty. Have a great day. Take care. Bye now.